Thank you for that welcome. My topic is about police brutality and if it is a problem or not. At the beginning of the summer when there was the George Floyd episode, I got so many messages and questions and concerns about what are we going to do about police brutality, because my practice is basically about the connection between brain health and behavior, and people said, you know, what are we going to do? What are we going to do about this problem? And so I decided to look into it more, and what I discovered looking at all the data that I could possibly look at to see if there actually was a police brutality problem, and there just isn't. There just is not an overwhelming problem with police brutality. Now, that does not mean that episodes do not occur and that we don't have violent, out-of-control behavior by some persons, but overwhelmingly, that is not a problem. However, yeah, oh, I was touching the screen. Okay, so this was the only example I could find where there were no curse words used in the rage attack. But is that behavior normal? Is that behavior ever normal? Is that kind of behavior ever okay? And the answer is no. In the world of psychiatry, that's called intermittent explosive disorder or a rage attack, and it is not considered a normal response to any situation. An article on the Cleveland Clinic website says that 1 out of 7 people in the United States will have an episode of a rage attack at some point in their life, so it is not a terribly uncommon kind of episode. But given that we don't believe that it's a normal behavior, where does it come from and what do we do about it? So where does violent behavior come from? Being that I'm a neurologist and I talk about brains, bad behavior comes from the brain. Bad behavior is a reflection of a bad brain. You cannot separate behavior, thoughts, emotions, actions. There's no such thing as a separation of psychiatry or something that's psychiatry from brain health, because all of the emotions, thoughts, actions, words, behaviors come from the brain. So where does violent behavior in the brain come from? I liked this particular picture because it gives you an idea of how the brain is positioned in the head, and you see the base of the brain, which is kind of down inside, it's down inside a bony structure, so the way that the brain acts when it is injured or violently shaken around, it acts like a flower on a stalk that's in a vase. And so the brain stem is held still while the brain itself shakes around. Now, to finish discussing the topic of, to finish talking about the topic of who are the police and is there police brutality, the police, the average age that a policeman starts or a policewoman starts being a police officer is 21. About 17% of the police are females, and the police experience a lot more trauma, physical trauma and emotional trauma than most of us understand. This summer in my private practice, I've experienced a flood of police officers coming to me with symptoms of what they've been diagnosed with, PTSD, but also other psychological complaints and brain injuries. But what traditional medicine and the public fail to make the connection that any of these symptoms actually represent a brain injury condition. You don't have anxiety, you don't have depression, you don't have inability to sleep, you don't have memory problems without having had some kind of brain injury condition. Okay, cursor. Okay, so when you look at this video, I want you to see what I'm seeing, okay? With the impact, with the violent shaking of the brain inside of the skull, you create an injury condition. It does not matter if you are wearing a helmet on your head or any other kind of protective gear when you experience that impact, because it is your brain shaking around inside of your head that triggers that injury. You see the first moment of impact where the front of the brain hits against the inside of the skull. So with that initial impact, you contuse or directly traumatize the front of the brain. But you see the second part of the injury, the contracture injury, is the brain goes, the far side of the brain, the back end of the brain hits against the inside of the skull, injuring the back area of the brain. But with the way that the brain shakes around inside of the skull, you have many other sources of injury. So when the brain shakes back and forth like that, you injure the axons, which are the long interconnecting pieces. All the cell bodies of the brain cells are all around the outside edge of the brain, and then the long interconnecting pieces come together and travel down through the brain stem. So when you shake the brain around inside the skull like that, you tear a lot of the small blood vessels that are in and around all the brain cells. You disrupt the glia, which is the support tissue around the brain cells. You cause shear injuries or tearing injuries to the axons, the long interconnecting pieces. Shaking the brain around like that disrupts the metabolic environment, the cellular environment around each brain cell, and the environment, the electrolytes, the chemicals around the brain cells are critically important to how the brain functions and communicates cell to cell. The other important thing that you can't see, but we know that happens, is you disrupt the microtubules. The microtubules are the internal structures of the brain cells. So microtubules go from the cell body and travel all the way down through the axon. They conduct electrical activity through the cell. They help all the nutrients travel through the cells. And so if you disrupt this internal structure, this microtubular structure, then you've totally disrupted the function of the cell. If this microtubular injury does not heal, then you begin to experience neurodegeneration of the cell, or a dying off of that cell. So even with a concussion injury, like we're seeing where you shake the brain around inside of the skull, even if it is not what they consider a major traumatic brain injury, you haven't broken your skull, you don't have an intracranial bleed, there's nothing massively wrong, you've still significantly injured your brain.
Well, first, you need to know that your brain actually sits in liquid inside your skull, so it floats and can move around. If it collides with something, the brain can move enough to bounce against the skull. That impact can leave the brain bruised, or even make small tears in the nerves.
Okay, and I just like that short video because it shows if you get struck from another angle on your head, how the brain shakes around and is disturbed in another way. But the important message from this is wearing a helmet to prevent a concussion or brain injury condition is as useful as wearing a mask to prevent coronavirus. Okay, it gives you a false sense of security and does not give you the protection that you need to have. And in fact, when they came out with the better football helmets, a lot of the football players decided to use their heads like battering rams because they thought they were protected from head injury by the helmets that they were wearing. So, let me go back to this one. So when we looked at this video and you saw the front of the brain bounce off of the inside of the skull, the important thing to see there is that you're damaging the frontal lobe of the brain. And the frontal lobe of the brain, the underside of the frontal lobe of the brain and its connections to the temporal lobe of your brain is the part of the brain that controls emotional stability and emotional regulation. So a concussion impact injury and the repeated concussion impact injuries are going to primarily injure the frontotemporal connections in the brain and cause people that are likely to have these kind of injuries to become emotionally unstable or to be emotionally unstable and be more likely to be irritable or be a person who might have a rage attack and maybe even not realize what they're doing. Okay, so how do I know that people have had concussion injuries and that the problems they're having are long-term consequences of concussions they've had in the past? Especially if we read their MRI report and it says, well, brain MRI looks normal for age, there's a little bit of atrophy, normal for age. The important part is that a routine brain MRI is a totally inadequate test to look for evidence of concussion injury. A routine brain MRI is useful for looking for tumors. It's useful for looking for what we call ischemia, or areas of poor blood flow. But if you want to see the evidence of chronic shear injury that has not healed, you need a special application of an MRI called a brain MRI DTI study, and that's what we're looking at here. So once your brain has experienced a shear injury, in other words, you've shaken your brain around inside of your skull and had a localized shear injury to your frontal lobes, along your corpus callosum, and you do not heal from that injury, then you begin a dying back process. The dying back process results in brain atrophy. In other words, it looks like brain shrinkage. But before the shrinkage, what you see is a disconnectedness of the brain fiber tracking. So the picture that you see to your right-hand side is an injured brain, and the picture on the left is somebody who had a significant brain injury in the distant past and did not heal from it. And so that brain has continued to deteriorate. But in both of those images, when you look at the connection to the front of the brain, is there a pointer, Jeremy? So I use it here, or? So, okay. Okay, so we're looking at this area right here, going up to the frontal lobe. This is the fiber tracts that are traveling up to the frontal lobe of the brain here, and from here to here. And so this is somebody that's had a lot of exposure to concussion, and they've disconnected those fiber tracts, and both of these patients particularly had problems with emotional dysregulation. And we can see that now when both of these MRIs were read as regular MRIs, they were read as normal for age. But you can only see specific pathology when you specifically look for that pathology. So when people ask me the question about police brutality, first I answer that we really don't have a problem with police brutality. However, the next part of the question is, people said, well, if we only changed the rules, then we wouldn't have any problems with people's behavior. But we know that it's not the rules that causes the problem. Somebody with a bad brain is dysregulated, and it doesn't matter what the rules are, because they're having trouble following the rules and regulating their emotional response to their situation. Even military veterans or military who are on the battlefield and engaged in warfare know their rules of engagement and regulate their behavior accordingly. So it's not whether the rules of engagement are adequate, it's whether the individual has a healthy brain and can follow those rules and can control their response to those rules. So what is the solution to bad behavior? And The issue of bad behavior is really important because different studies show 65 to 85% of people that are incarcerated have had significant brain injuries during their life. So what are we accomplishing if we don't address the problem, the underlying problem to the bad behavior? So my solution is to pay more attention to brain health and understand the brain health condition, because you can't counsel an injured brain, you can't retrain an injured brain. You need a healthy brain in order to be successful with any kind of interventions. When I see a patient that's had a lot of brain injury and I know they're going to need more therapies, we still start with nutrient optimization, checking nutritional parameters, checking endocrinological parameters, coming up with the nutrition plan, starting them in the hyperbaric chamber, and we do initial 40 treatments before we even think about sending them to try to do recovery and counseling and other therapies, because it doesn't make any sense to try to retrain an injured brain. You need to start the healing process first. So the first image would be what a totally healthy brain MRI DTI would look like with all the fiber tracking. The second picture has to do with monitoring somebody's recovery. One of the most common symptoms of a concussive brain injury is having problems with visual tracking, with your eyes moving together, working together to visually fixate and follow. And so there are automated tests, particularly a test that I like a lot is called Right IQ, and it gives us an objective measure of what somebody's functional vision is. So we can follow people with that kind of evaluation and get a sense of how the networking in their brain is healing. Because many times it's possible to learn how to cope with a situation or, retrain your balance without actually healing the brain connections. But there is a uniqueness to the ability to visually fixate and follow so that we can use it as a repeated test. And of course, the last image is my hyperbaric chamber, which I've been using for 16 years to treat a whole spectrum of neurologic conditions. I've treated over 1,000 patients. I've treated people for stroke recovery, concussion. The military veterans and police officers, law enforcement officers I treat are primarily TBI, PTSD. They've been shot, they've been in car accidents, they've been assaulted. But we do have a solid record of healing our patients and good recovery. And in fact, in terms of using hyperbaric for recovery from brain injury conditions, there was just a law that was passed through the Senate, passed on to the US House, to try to establish hyperbaric as standard of care for military veterans with TBI, PTSD. You know that typically changes occur in military medicine and then follow in civilian medicine. But it's starting to happen that hyperbaric will be used as one of those healing tools. Hyperbaric oxygen therapy is the only treatment that's ever been shown to heal any brain injury condition. And unfortunately, the brain MRI DTI that I'm showing you, this kind of imaging has been available for 20 years. recognized, approved by the FDA, available for 20 years. The military's not doing it, the VA's not doing it, the NFL is not doing it, professional sports are not doing it. They're not doing it on law enforcement officers or anyone who really needs to be screened for these kind of health issues. So it is troublesome and problematic that the kind of imaging and monitoring that these different professionals should have is not being done. And it's not being done because they don't want to recognize or acknowledge the problem, because if you recognize and acknowledge the problem, then you have to treat it. And it is still the overwhelming belief of traditional medicine that there is no treatment for this kind of injury condition. Yet, the scary thing is the explosion of diagnosis of dementia that we're seeing in the United States and worldwide. And there's so many ways that we could heal these brain injury conditions if they were recognized as brain injury conditions and actively treated. And I stand with the thin blue line and my police officers. Okay. And I'm here to take questions.
Yes, I had a quick question. You said that 65 to 85% of prisoners showed signs of brain injury. Okay. You said that 65 to 85% of prisoners showed signs of brain injury.
All different studies all over the place, but
Yeah.
yes,
Do you know how that compares to the general population?
I don't.
Okay.
I don't, but what I will say is that concussion brain injury goes largely unrecognized, because when you ask somebody if they've had a concussion, they say no. They don't realize that they have suffered an injury. For example, I treated a middle-aged woman who had quite severe dementia, and it looked like she had a post-concussion syndrome, and I asked her over and over and over, if she'd been injured, if she had thought of anything, if she could remember a head injury, and she kept saying no. And I finally discovered that she had been a competitive diver. And, when you dive, your head smacks the water all the time, and I guess sometimes they hit their head on the bottom of the pool when something goes wrong. And so she had had all these injuries over a 12-year period of time that she did not recognize as concussion. And so she said, no, I've never had a concussion. But her brain MRI DTI looked like a severe advanced, chronic traumatic encephalopathy.
Yeah, okay. I was just curious because I thought it'd be good to know if there was a difference between the general public and...
Well, and a lot of people, in their childhood, had situations, they got the hell beat out of them, but they considered it emotional abuse. They didn't consider that they had a concussion, even though they were shaken and hit and thrown, and certainly those kind of injuries are more significant when you experience them as a child.
Yeah, thanks.
Yes.
Hi. Is there a time between injury and treatment that is crucial, or you just pointed out children and so forth? If they get treatment later in life or in any kind of injury, could it be helpful?
It can be helpful, and of course, the sooner that you get treatment, the better your clinical outcome is going to be. There is a clinical researcher in South Dakota who's working with elementary school students playing football, things like that, and the study is to try to get them in to the hyperbaric chamber within hours of insult. And they're able to treat kids, 1 to 5 times with good return to baseline. And I have to say, they're using a quantitative EEG to measure their outcome results, not a brain MRI DTI. But there is a big difference between being able to recover clinically, in other words, being able to function again, versus the actual biologic healing of your brain. And so many of the schools, and they're working with return to play, like should you rest for 5 days or 7 days? It's like if you had a concussion that was significant enough to cause symptoms that people recognize, you should sit out the whole year, and you should have some kind of monitoring, like the right IQ test, the objective measure of visual function to see where you stand, and not just, are you feeling okay and can you do a simple balance test?
Okay, then just a follow-up. Is there a certain point in time where it's hopeless, where nothing will repair the brain from injury to that time?
The experience of the national, international community of people that use hyperbaric is there is always recovery, but will you get as much recovery as when you do it 25 years later as if you did it 5 days later? No, but some recovery is always possible. And in Israel, the doctor that's running studies in the chamber over there, Dr. Shaya Fradi, is treating people 25 years post-stroke and seeing good results.
Hi, I'm a family doctor, and this may be old, but I've always heard that if you had a concussion, like say at a high school football game, that there's sort of a glutamate storm, and we had been taught that maybe memantine or Namenda was appropriate at that time to use that acutely, but even long term, it's approved as an Alzheimer's drug, but Namenda I've always thought was pretty harmless and could be used. And I wondered if you had any experience using that or clinical detail on that. The other is, how much do you use neuropsych testing?
Okay, first the Namenda question. I mean, the way that I work, my first priority would be to get someone in the chamber and do at least a few healing treatments after an acute injury. And so I wouldn't use a drug, I just try to get them healing. But my neuropharmacologist colleague and I, Dr. Tim Marshall, wrote a paper, and he has a national reputation, and his recommendations are magnesium, lithium, and zinc are the 3 most important trace minerals to heal from a brain injury condition. And he also recommends the product Oxalent, which is a vitamin mineral drink mix, to make sure that your patient has all the building blocks to heal their brain. So along with the hyperbaric. So that is his recommendation. I am aware of Namenda, and in the distant past, I have prescribed it for older patients with dementia. But now I would take a different approach. And your second question again?
Well, it's curious to me because people have avoided monosodium glutamate at Chinese restaurants and so forth. But,
Sure.
Glutamate sticks to the neuron and can actually kill it after a while. It's a stimulant,
Yes.
but it'll kill it after a while. So Namenda blocks or memantine blocks glutamate from sticking to the neuron and seem to have some good effects. But the other question was about the neuropsych testing. How extensive do you use
Neuropsych
it?
testing. So I see a tremendous number of veterans, and I have a nonprofit that sponsors our veterans, and we do a series of testing before and after so we can share with people that are supporting and sponsoring our veterans the improvement that they have had. So we do have an online cognitive test that we do.
Thank you very much, Dr. Henricks. Really appreciate
Thanks.
your work. Okay. And, okay.